Hello, Medicos. How are you? So, as discussed, today is our new lecture. As you know, the renal disease patients are increasing because in the last few decades, you can see the renal patients are increasing, and 1 out of 7 people are getting renal affected, according to the census or statistics I have read from some journals. So, today we'll discuss the diet plan for renal disease patients. So, coming that kidney normally remove waste product and extra fluid from blood which comes from food we eat like and the liquids we drink. Impaired of the function of kidney leads to retention of these waste product in the body. The renal diet is an essential part of treatment. It helps to keep you healthy and slow down the loss of kidney function and avoids complications like fluid overload, high blood potassium, itching and bone disease, and weight loss. Now, the dietary guidelines like the dietary advice you are given depends on the number of factors, including the renal disease staging, the type of treatment you are on, your blood result, and presence of other medical conditions like diabetes or hypercholesterolemia. In general, the diet control the amount of protein, phosphorus, potassium, and sodium. Energy intake should be optimum to maintain the ideal body weight. Now, the quality of proteins in the body, protein in food breaks down into a waste product called urea. In kidney disease, you may need to reduce the amount of protein you eat to avoid buildup of urea in your body. Some source of protein produce less weight than others, and these are called as high biological value proteins. These you should take. Eat 50% of your protein from high biological value source and distribute them well in your diet. Now, the high biological value proteins are like milk and milk products, meat, fish and poultry, egg, soybean and its product. So you should eat them. And the low biological value like cereals and its products, dal, pulses, nuts and oil seeds, vegetables like peas and beans, you should avoid them. Now, some hints for the sodium and salt restriction. Limit the amount of sodium and salt in your diet as high blood pressure and kidney disease and sodium are often related. Use salt discreetly. Consume one tablespoon or that is equivalent to 3 to 5 gram. Do not add uh, s- salt in menu like chapati salad, rice, soups, or similar. Make use of flavors like fresh lime juice, onion flakes, mango powder, that is amchur, vinegar, tamarind pulp, imli, you can call, and kokum and garlic, ginger, green chilies. Prepare meal without having ajinomoto, that is MSG, that is very harmful for the health, and the baking soda, powder. Make use of uh, curds, which is sour, and also the chilled water to return color and alike. Avoid papad, chutney, pickle, chips, masala, sauce, bread, and baked items. Salt substitute usually contain KCl, potassium chloride. They may contribute to a significant amount of potassium, so should be checked in with the doctor before using it. Choose grill, steam, prepare in gravy, lean portion of white meat. Do not consume organ meat, and fresh river water fish are preferred to seafood. Check of salt substitute as they are high in potassium, so you shouldn't avoid it. Helpful hints for the potassium restriction. Potassium restriction may not be necessarily in the early stage of kidney disease. However, it is good to follow the instruction. We should avoid the high potassium food like apricots, avocados, banana, beet, Brussels sprout, calms, dates, figs, kiwi, fruit, lima beans, melons, coconut water, peanuts, potatoes, green juices, resin, sardines, spinach, sweet lime, potato. You should avoid them. That's why I marked it red. Restrict the consumption of the marked red high potassium food. Vegetable and dals can be leached to reduce their potassium content. Like you can peel them, soaked in large amount of lukewarm warm water. Drain the water and rinse before cooking. Prepare pulse and legumes in gravy. Help restrict its quantity. Judiciously include condiments and spices to improve uh, palatability. Fruits like apple, papaya, pineapple, guava, and pears are comparatively low in potassium, so these fruits can be taken in low quantity. Now, manage your fluid intake. Extract fluid affect your blood pressure and the can increase workload in your heart. Do not exceed the fluid restriction recommended by the doctors. Fluid intake like water, milk, fruit juices, non-alcoholic beverage, buttermilk, jelly, ice cream, soups, dal, gravies, and hot drinks, milks, etc. Keep a record of what you are drinking. Drink from a small cup or a glass. Avoid salty, dried, and fried food as they increase thirst, and include the fluid through medicines. Calcium and phosphorus in the renal disease with kidney function being impaired. Calcium is reabsorbed from bones and decrease excretion of phosphorus. This could lead to weaker bones and may cause itching. To prevent this, increase dietary calcium and restrict phosphorus. Food like milk and cheese, dried beans, peas, colas, nuts, and peanuts, butter are high in phosphorus. Restrict them. However, incorporating milk and its product in the prescribed amount as it provided good quality protein and calcium. Restrict intake of leafy vegetable because it contains phytates and oxalic acid present which prevent calcium absorption. Use phosphate binders as prescribed. Now the uh, you can say phosphorus binders are you it will be used to decrease the absorption of phosphate from food and in digestive tract. So binders are prescribed to decrease their absorption and it will be useful. Now these dietary guidelines, I'll make two images and I'll post in Instagram also where you can get easily in the M4PG Med Instagram link. And if you want more dietary videos, you can follow our YouTube channel that is M4PG Med. Also, we are in Instagram as M4PG Med, Twitter M4PG, Facebook M4PG, and M4PG.com as group where I post all the MCQs and notes. Also, you can join the subject wise group in M4PG.com study group. In all subject wise group are there. We post regularly images, notes, and everything. Thank you for your patient listening. And next time we'll come with the next week with the new lectures about another disease diets or fat loss diet, weight loss diet. And also I'll be trying to take lecture about a USMLE and PLAB. So stay tuned. Thank you.